Women, have you ever felt like your insides are being torn to shreds? Or like your uterus is on fire and you're sweating bullets and puking once a month? If so, then continue watching because this episode is all about endometriosis and some other internal reproductive organ problems. So basically it all started with, irregular periods and cramping that got worse and worse with each passing year. Like when I was a teenager, the cramping would be bad sometimes, a few months out of the year where I'd have to take a lot of Advil and maybe stay home from school. But for the most part, it would just probably be crampy the day or so before. And that was normal for me until my late 20s when it started to get worse, the pain, and same with irregular periods also. And by irregular, I mean 10 to 15 day long periods where they just wouldn't stop, and then another 15 days of spotting, which is really crappy to try and plan your life around, or try to be single, or if you have a boyfriend or a new boyfriend and things happen, but oh no, sorry, I'm on my period all the time. So other than the irregularity, the pain also was horrible in the last few years before I got my surgery. Knowing now what the pain was, I know that it was all because of endometriosis, fibroids, and polyps. So those three main things, each one in and of itself can cause a lot of pain, but to have three all at once was unbearable. And what was the pain like? It was like a deep and heavy pain where it felt like it was weighing me down, and where the pain would sometimes radiate to my back, or the pain would even radiate down, shooting down my legs too. So with that constant deep sore pain, there was also occasionally stabbing or fun tinges of oh my god, and then it'd be okay, but still with the constant something's wrong, it's really, really painful. And so usually I could catch it, right when I started to feel tingling of there could be cramps coming. Then I knew I had to take ibuprofen right away, or else I'm in for it. The worst episode I've ever had when I was around 28. It was in the summertime. Of course, it started with horrendous cramps. I didn't catch it in time to take ibuprofen for it. I was hoping to just suffer through it. I can't remember why. I probably was hungover and didn't want to take ibuprofen. Can't remember. Either way, I just know I didn't catch it in time with painkillers. So then it morphed into basically the worst cramps I've ever had in my life. It was waves of cramps too, where it felt like contractions, really. It was horrible, obviously, fetal position cramps, but then it would come in a big wash over me, and it would just be horrible pain where I'd have to hold on to things, hold on to the side of the bathtub, hold on to the side of the bed, hold on to anything, and just clench down and wait for it to pass, maybe 10 seconds or so, and then it would sort of pass, and I'd be like, okay, it's good, and it would just be a low-lying pain that was bearable, in comparison to what had just happened. And I'd be like, okay, now I can get up, I can move to bed, I can do whatever, because it's going to come again. And then I'd have, maybe 15 seconds of that, of just calm. Still painful, but still calm. And then it would happen again. I'd be like, okay, I got to hold on to something, because it would be another wave, contraction really, of horrible pain. And I'm sweating. I was actually living at my friend's house at the time. I wasn't living anywhere. I stayed in her spare room. And so I would go to the bathroom and then come back in come back in and lay in the fetal position in bed. And I felt like I had to push. That's just a characteristic of it, I guess, endometriosis, to feel like there's a pressure just with all the pain and everything. And I'm sure it was just a combination of all the different problems I had, undiagnosed problems at the time, that made me feel like I had to go to emergency. I didn't end up going to emergency because finally the ibuprofen I took kicked in. So obviously I knew something was wrong. So I went to my doctor, and I had been going to my doctor, once a year, something like that, up until this point, and saying, irregularities, things like that. But at the time, I was drinking a lot. I was smoking. I wasn't sleeping well. I was under a lot of stress for years and years and years, and just really ridiculous lifestyle. So my doctor said, well, the irregular periods and things like that is normal, and cramps are normal, so it's totally fine. You'll be fine. But after this episode, I knew something was not fine. Something was wrong. So I went back to my doctor, and I basically demanded that she refer me to a gynecologist. Anyway, a few months down the road, I finally met with the gynecologist, and that began my probably a year long of different tests and scans and ultrasound. So over that year that I had all those procedures done, one of the procedures was a Saline Infusion Sonohysterography, or a saline ultrasound uterine scan. Don't know how to say that word, sorry. Or SIS is the acronym for it. And that is the procedure where they, basically it's like a PAP. They go in through your cervix and then fill your uterus with like a fluid. And then they do an ultrasound to get better pictures. That was sort of pretty uncomfortable, but it got a lot better pictures than a normal ultrasound would, I guess. Other than that, I had blood work, and I had a CT scan, a pelvic CT scan, where you go into that long metal tube, a really loud tube with headphones on, and they take pictures of your abdominal cavity. And from that scan, the gynecologist seen, that I had, she's seen a fibroid there. Looked like I probably had endometriosis, couldn't really tell, and said I had beautiful ovaries. Literally, that's what she said. Pretty much one of the weirdest, coolest compliments I've ever gotten. So then I had my surgery. That was January 2014. And I had laparoscopic surgery, and I had hysteroscopic surgery. A laparoscope is where they would go in your abdominal cavity, look around at the organs and take tissue samples if they need to. They would basically just insert a long tube with a light at the end of it and look around. A hysteroscopic surgery is where they would go inside your uterus to do any corrections that they would need to do. So both of those were done for me, and I guess I can show you the scars. So the first one, they went inside my belly button, inside there. Then there was another tube that went in here. You can see the tiny little incision. This is 2 years old, so this is how big the incision is now. It's about 1 centimeter. It's little, little mark there that you can see. So one on my belly button, one right there, and there was one right here. I'm not going to show you, but basically, right above that bone there that you feel. So those 3 spots there, that's where they had put in, the light and any kind of instruments that they had to go in and look around in my lady parts. I remember waking up from surgery, obviously super drowsy, and they asked if I was in pain. I said I was, so they gave me an IV drip of Dilaudid, which is insane. That's like chemically similar to morphine, and I'll tell you, it friggin' worked. I remember like once it went in my system, I basically all of a sudden felt like, yeah, I was on drugs, because I was. And, but it was, I remember moving my head, and then like the whole world would move my head with me, and then I would come into consciousness of what was going on. Like there was a delay somewhere in my, perception, I guess. Again, that was the drugs, and that was the coming off of anesthetic. And I remember, so I just like closed my eyes. I was like, okay, the drugs are kicking in, my pain's going to start to decrease, and I'm going to feel better. And I closed my eyes, and I remember I could, my breathing got slower, and which was fine, that happens. And but I remember I had to remind myself to take another inhale, and at the same time I could hear my heart rate got a lot slower. Like I could hear it. It would be like boom, boom. Maybe not. It felt like it was that slow. I'm pretty sure it was, and I know it does decrease your heart rate. So that was crazy. Pretty sure I dozed off. I woke up. Mom came to the hospital to pick me up and bring me home, and so I went home. She set me up on the couch and got me everything I needed, and And she said that it could happen where sometimes when you're out of surgery and, there's drugs still in your system, you could feel a little loopy and high, which I did. I felt super loopy. I felt like I needed to make granola bars. Mom wouldn't let me, thankfully. Wouldn't let me near the stove or anything like that. But she did say that it can happen sometimes where, you get super ambitious and you want to like clean the house or change all the light bulbs or do something crazy. And again, that's just like, I guess the effects of the drugs wearing off and things like that. But for me, I just wanted to make granola bars and write a Facebook status update. I didn't tell anybody really about my surgery or anything like that other than a few close friends. But post-surgery, I felt like I needed to update Facebook. So here's the Facebook status that I wrote to update everybody on how the surgery went, even though nobody knew I even had surgery or that there even was a problem. Surgery went good. The remnants of Dilaudid and anesthesia in my body are causing me to feel incredibly dumb and even more strangely ambitious. I can see why they tell me I need supervision, because I really want to whimsically sign legal documents while driving a tractor as I'm doing a puzzle and talking a bunch, all while sleeping and drinking Tim Hortons coffee. Okay, this probably wasn't the best time to update my status, haha. And sure, maybe it wasn't, but who cares? It's friggin' hilarious. So it took me a few days to recover. Really, just my belly was super sore. The incisions were really sore. I had to take it easy, had to walk slow and around to the bathroom and, keep my fluids up and continue to eat good and things like that. But I can tell you, the air bubbles inside my abdominal cavity were so painful. And that is something that they warn you about whenever you have abdominal surgery. Because CO2 bubbles that are left over get trapped inside, basically, and they have to make their way out. So they begin to rise up to the level of your diaphragm. So basically, it's painful gas pains. We've all felt gas pains before. And usually, obviously, they're here. But imagine having them all throughout here. And concentrated up around here because gravity that's just the way they go. They rise up and then eventually they're expelled out of your body. But the pain, oh God, it would hurt to laugh. Just like super uncomfortable gas bubbles. And my boyfriend's hilarious. So I had to basically say stop being funny, stop being yourself, because it hurts so bad to laugh. So anyway, I met with the surgeon to figure out what happened really. So I was officially diagnosed with a fibroid, which was really only this big. Some women get fibroids that are like this big, but mine was only that small, and it caused me so much pain. So really, even if they say it's super small, it can cause a lot of discomfort. But of course, it was combined with polyps as well. That's other growths and endometriosis. So she went in there and cleaned up some endometrial tissue that was laying around and causing more pain and bleeding, and she also fixed one of the adhesions I had. I had an adhesion from endometriosis that was connecting one of my fallopian tubes to a part of my bowel, getting it all kinked up. So she cut that basically and made it back to normal. So one of my tubes is partially blocked, but that's okay. So she went in there and cleaned it all up, and it was amazing. And ever since that surgery, 2 years now, knock on wood, I really haven't had any problems. I didn't really get any more cramping. My periods went back to normal, which was insane. It took a few months to get back into the rhythm of normal, but relatively soon, maybe 2 months later or something like that, I was back to a normal cycle and didn't really have very many cramps. Maybe every 3-4 months I'll get cramps where I'll have to take one ibuprofen and I'm fine. Other months I don't have cramping at all. Some months I will have, a little ripple of pain here, a little stab of pain there, but that's it. It's not even close to how it was before. So basically the moral of the story is listen to your body. Excruciating pain is not normal. Go to your doctor, make them listen to you. If they won't, make them refer you to a gynecologist. Get this stuff checked out because it's not normal if you're having these many problems and so many weird symptoms. Because your fertility could be at risk, and of course your quality of life is diminished. So get anything checked out. If you think it's not normal, Even if you think it's no big deal, it could lead to something big. Again, like I said, I'm not a doctor. Just like check things out if you need to. I just wanted to share my story, what happened to me, and basically give hope to anybody who might be experiencing this, that there is a light at the end of the tunnel and it will be okay. You just have to stay persistent and listen to your body. So thank you for watching. And if you're about to have any of these procedures or surgeries that I just talked about, then good luck. Try not to worry. I know it's hard and I know it's scary, but really you'll be so glad that you went through with it and finally got things taken care of. And a lot of these procedures and surgeries that I talked about are very common, so you will be in good hands. The doctors know what they're doing, and the recovery isn't that bad. So if you have any questions, please leave a comment below. And if you liked this video, please give it a thumbs up there. And of course, better yet, subscribe to my channel to get more content from me and to learn more and to see more and all that stuff, because I put out really cool videos. And yeah, thanks for watching. Bye. Au revoir.